Okay, doctorarjaybe here, and I wanted to talk a little bit about atypical chest pain. Um, Frequently, as a physician, I have people who come in because they're having chest pain problems. And Hopefully, when I talk to them, I can differentiate between, heart disease risk and non-heart disease risk. Um, it's not a 100% thing, so we always have to be careful. But there are other reasons for having chest pain besides the heart. If you are having a problem with, let's say, asthma, and because of that, you have an increased difficulty with breathing, you can have some discomfort in your chest because of the asthma. Um, Somebody who has an infection and is coughing a lot, the cough can irritate the chest and cause chest discomfort. Somebody who has esophageal reflux and heartburn can have discomfort in the chest, which is from the heartburn, but actually is not the heart. Um, uh, and of course, somebody who exercises a lot could have chest pain because of muscle discomfort that really doesn't have anything to do with the heart. No. As a physician, we try to talk to our patients, try to get the story of what's going on, how often it happens, when it happens, etc., and try to make a determination. Um, I know in my own practice, um, what I basically did was this. If I felt strongly that this was a heart problem, I would try to get an EKG done right away. If there was any problem with the EKG, I would send that person to a cardiologist. Um, if there was some question of whether this was heart or some not heart issue, I would take the information and then if it sounds like that the heart issue was a lower probability, I would send the person for an exercise stress test and see what happens when we push the heart. Now, if somebody is having chest pain because of a heart issue and you have them exercise, exercise requires more oxygen than if you're just sitting still. Because of this, if there's any problems with the heart, they're going to be magnified with the exercise. And so by doing an exercise stress test, if that person passes the test with no problems, um, it's not very likely then that they have heart disease. Um, and then you can kind of go on other things, based on the history, whether you have to treat the person with anti-ulcer medication, um, uh, medications for their asthma or chronic bronchitis, or maybe give them muscle relaxant for muscular chest pain. Um, uh, so this is kind of like the process that I, as a physician, went through when I saw patients who came in for chest pain, and I wanted to try to triage them and decide which ones are more serious, which ones are less serious. Um, uh, Again, if there was any question, I could always send them to the cardiologist, get an opinion. And if it was really important and I got an EKG and the EKG came back up normal, we would even call the ambulance and get them to the hospital. We did have to do that for one of the patients. And Fortunately, it did turn out that it was heart disease that was picked up and managed correctly. And that person probably would have gone on to develop a heart attack if it hadn't been treated that day. Um, so they were seen in the emergency room. seen by the cardiologist, had some testing done, realized that they were in serious condition, and had treatment for their heart disease, and now able to go on and live a normal life. Okay, so this basic idea of chest pain as I saw it in my practice.